Hello. Good evening, fellow friends and loved ones. It's once again another Sunday evening, the 10th of January, the second Sunday of this wonderful year, 2021. Yes, God has been once again faithful unto us, and His mercies has granted us a new week. Yes, the Sunday, 10th of January, and we are continuing our discussion on the various health conditions, and today is no exception. Yes, many of us were asking the meaning of the topic, and I know it's quite a big word, and very simple word. It's a very simple word, and that is knee pain. But among knee pain, we have so many conditions that arise from this big word. And so today, we're talking about the condition Chondromalacia patellae. Yes, it's a condition that affects the knee. Yes, and there are so many conditions in the knee. Actually, the knee is a very complex structure anatomically, that is, as a human being. So thank you very much. So our outline for this presentation is a topic, the codes, the causes, the symptoms, various diagnostic procedures, the treatments, and then we will look at some of the lifestyle modifications to be able to give a very good management to this condition. So I'm very glad to lead in this presentation, and if you have any question, please, the floor is open to be able to ask questions. Yes, if you want more questions and suggestions and comments, and they are all welcome. Okay, so today's quote is actually a very simple quote. That is, trust God. Yes, a simple quote. Trust God. In everything you do, just trust God, and then step by step He'll just bring you to wherever you have desired to be able to get to. So just trust God. Okay, so today we are talking about the condition Chondromalacia patellae. Simply put, knee pain. Okay, so Chondromalacia patellae is a condition where there's a structure in the knee called a patella. We'll see the patella presentations very soon. So in your knee, you have a very small bone in your knee. I'm sure when you touch your knee, you can see a small bone in your knee that moves sideways and sideways. You can push forward. So this bone is very important structure. It's called the patella. It helps us to raise our leg up and down. If this bone is out, in fact, you can't raise your leg. It's almost impossible. It acts as a joint or a structure that helps us to raise our legs, and also helps us to walk without falling forward. So let's take important notes of this structure called the patella. Okay, so this condition called Chondromalacia patellae is where we have a structure under the patella called a cartilage. So the cartilage is also a structure that prevents the bone to bone interaction. So if you have the patella is a sesamoid structure. That's a circular structure that sits on the thigh bone. So it's a joint in between the thigh bone and the leg bone, and that helps us to bend our leg forward and backwards. So under this structure called the patella, we have the cartilage, the articular cartilage. So when you have the patella on that cartilage, it prevents the bone from coming and rubbing against each other, and it also helps us to move very effectively. So when we have this cartilage wearing off, or for a better word, deteriorating, we can have this condition called Chondromalacia patellae. And then we could have the presentation of this structure called the cartilage becoming soft. Then we can have Chondromalacia patellae. So just to break these two things down, Chondromalacia patellae comes from two words. Chondromalacia. Chondro means cartilage. Malacia means softening in the Greek word. Okay, so I'm sure we get it. So these deterioration or degenerative changes of this structure called articular cartilage occurs behind the patella. So if there's patella bone, under it is where we find the articular cartilage. So this structure can be worn away by activities, by walking, by engaging in strenuous activities like walking, like climbing steps, and so many activities. And these ones could cause this cartilage to wear out very, very early. So this condition called the Chondromalacia patellae, or we could say, for a better word, knee pain, occurs among young and athletic individuals. When we say athletic individuals, it means that they are those who are very active and then they engage in sports such as running, weightlifting, and so many activities. So this condition are found mostly in the young and in athletic individuals. So statistics shows that that is United States of America, that's USA, 1 out of 4 people have this condition called the Chondromalacia patellae, that is knee pain. And then the age range is between 13 and 35. So you see that these people are active individuals. Okay, so this softening of this cartilage under the bone, the patella, causes wearing away of this structure called the articular cartilage, and this could lead to a scientific name called fibrillation, fissuring, and erosion. That is wearing away of this structure called articular cartilage. So some of the conditions that could look like this condition we're talking about, that is knee pain, could be patellofemoral pain syndrome or patellar tendinopathy. These conditions also look alike, but then there are other tests that we're talking about to be able to separate this condition from this particular condition called knee pain or Chondromalacia patellae. Okay, so before we continue, just look at some pictures, some anatomical pictures of this condition, so that we see that yes, we can appreciate this condition. Okay, so we can see on the picture here that yes, yes, we can see this structure here. That is the knee, the whole place, the knee. You can see your knee here, and we have, this is what I'm talking about, the patella. The patella. So it's just in front of your knee. It's a patella, very important structure to help us walk without falling. So it's the patella, and under the patella we have a tendon that crosses down to the leg bone. This part of the structure is called the tibia tuberosity, and an insect called the tibia tubercle. So this is a structure called the bursa, and this also prevents contact of the tendon to the bone and the muscle also to the bone. So this structure helps to lubricate or keep the joint free in movement. And you have a structure here called also a fat. So this fat also prevents and minimizes shock as you are walking. So this is very important structure. And then this is the patella, and under it is found the cartilage, the articular cartilage. You can see here. So we'll show you a very good example or picture very soon. And then we also have the joint capsule here. We have so you can see the cartilage under the bone here, another cartilage here, and then we have a structure we call meniscus, also preventing this bone from interacting with this bone. And then this is the thigh bone called the femur, another synovial tissue. Okay, so let's look at some pictures. Okay, so if you see the knee, this is the knee. So this is the front part of the knee. You can see this is the patella bone. Everyone has some. Every human being has some. And then we have a muscle here called the vastus lateralis. That is at the outside of the leg, and this is the inside of the leg called the vastus medialis obliquus. Okay, so let's continue in our discussion. Okay, so there's so many structures in the knee, and then we're just going to look about some of the structures. We have the vastus lateralis, vastus medialis obliquus, the picture we saw just recently. They help to keep the knee very stable and then prevent it from movement. Okay, so under this structure called the patella, we mentioned that we have the articular cartilage. It's very important, so that when we are walking, the bone doesn't have constant interaction. And then we have something we call Q angle. So it's an angle in between the hip region to the knee region. So when you have it so big, the angle so big, it could cause us to have this condition called Chondromalacia patellae, that is knee pain, and then we could be treated at the hospital. The other structures around the knee also that could cause us to have this condition. When we have a short iliotibial band structure, that is, it's a structure at the side of the leg. When you have it being short, it could also have this condition. Okay, so we're looking at what causes this condition called Chondromalacia patellae. We could have trauma, that is when you have a blow to your knee region, that is the front part of your knee. It could cause this cartilage to get torn or to wear away very easily, and this could cause this condition called Chondromalacia patellae. We could also have instability of the knee, that is, we have instability around the knee joint, and this could also cause this condition called Chondromalacia patellae. Could have also overload injury, where you constantly put pressure on the knee, such as climbing steps constantly. This could cause Chondromalacia patellae. We could have so many conditions. We could have also shortness of some of the muscles around the knee, and this could cause increased pressure around the knee joint, and we could have this cartilage wearing away because of undue pressure on this cartilage. Could also have excessive tearing of the foot, which could cause shortening of some structures, and this could cause this condition called Chondromalacia patellae. Could also have vastus medialis insufficiency. So the picture we saw before, I showed you a muscle outside and a muscle inside. The muscle outside being vastus lateralis, and then the muscle inside called vastus medialis obliquus. So this structure called the vastus medialis obliquus, that's a VMO, is a very important structure. So when we have it being weak, then we could predispose the patella to have the structure that's under it called the cartilage wearing off very easily, and this could also cause Chondromalacia patellae, or knee pain for simple. And also very importantly, we could have degenerative changes, that is when we have wearing away of this structure called the articular cartilage. This could cause Chondromalacia patellae, where we have reduction in the articular cartilage very constantly. Okay, so aside that, this condition called Chondromalacia patellae can be in stages. We have 4 stages in this condition called Chondromalacia patellae. It's not a condition that comes all of a sudden. Some people are asymptomatic, that is, they don't show the signs at a go, but then as time goes on, the pain increases and it becomes very severe, and then they report. But when you notice you have knee pain, you just need to come to the hospital so that we can assess you and then see whether it's that condition. Then we can prevent it as early as possible. We have 4 stages. The first stage, we have maybe some general or intermittent or irregular pain in the knee. Secondly, the second stage could have destruction of this structure called the articular cartilage minimally, but then you can bear and then go about the daily activities. The third stage is where we have 50% of this cartilage being worn out by various tests such as radiography, that is through X-rays you can see, or MRI, you can see parts of the cartilage wearing away. And then the last stage, where we have more than 50% of this cartilage called articular cartilage wearing away, and this one is very severe and management becomes difficult. At the latter stage, we could resort to surgical means when nothing is possible and when the person or the patient experiences a severe pain. Okay, so we talked about the stages of this condition called Chondromalacia patellae. One very important point we have to note is that articular cartilage have no nerve endings. When we talk about nerve endings, it means that where we feel or we can be able to touch for the person to feel pain. So the articular cartilage doesn't produce pain, unlike other conditions that around the knee that when you touch you feel the pain. But then through various tests such as X-ray, special tests that physiotherapists carry out, be able to diagnose this condition called Chondromalacia Patelllae, because it affects the cartilage most of the times, not the bone, not the tendon, not the ligament, but the cartilage. Okay, so this condition can be a true source of anterior knee pain. So it could look like anterior knee pain, but then it is not actual anterior knee pain as generally described. There could be also other findings such as surgical findings and then the pathological findings. So when we talk about the characteristics of this condition, that is when you come to the hospital, what you see or we would like to see, as medically we say signs. Symptoms are what the patient tells you about, but the signs are what we discover from our various tests. Okay, so one thing is that this condition called Chondromalacia Patelllae is found at only one side of the knee. Unlike other conditions such as osteoarthritis, where we have the whole knee experiencing pain, but this condition called Chondromalacia Patelllae is at only one side, that is the front part of the knee under the patella, the small bone in the knee that you can move from side to side. Yes, I'm sure you have a picture of it. We've shown you some pictures, but after that, this will show you more pictures about this condition called Chondromalacia Patelllae. So some of the signs that will be seen by the medical practitioner is that we can experience tenderness under the knee when we are palpating. So when we put our hand there, we could feel tenderness. When we shift the knee, that's the bone, to one side, either the left or the right side, we can feel tenderness on the knee. We could also feel crepitation. Crepitation means the noise that you hear in the knee. So when the patient squats and goes down and comes up and goes and comes out, you hear crepitation, that is, you hear crack, 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 crack in the knee. These are signs that show that the person could have this condition called Chondromalacia Patelllae. There could also be minor swelling in the knee. So the swelling in the knee doesn't become so huge or so big, but then there's minor swelling. There's also weakness in the vastus medialis muscle. So the picture we saw earlier on, where we have the muscle inside, it becomes weak. So even raising of your leg upwards when you're sitting down becomes difficult. And these are signs of this condition being present in the person or the individual. And also you could have high IQ angle. So I'm sure you understand it by the picture that will be shown to you very soon. A high IQ angle. So another point to note is that the causes of this deficit cause weakness in this whole structure in the thigh, the muscle in the thigh called the quadriceps muscle. So when this is affected, the person cannot walk well. The person has to get a knee support or rest for a longer time or longer period. So signal members of this condition, they present themselves as asymptomatic, as we mentioned earlier on, that they don't show signs and symptoms. The first stage, they might not show sign. The second stage might not show sign. The third and the fourth stage is where then everything becomes very serious, and then they present themselves as to the hospital to be treated. But then, as we said, when we notice any sign of weakness in the knee, it's very important to report as early as possible. So we're talking about the condition Chondromalacia Patelllae. Simply put, knee pain. Okay, so we have two main types of this condition. We have the idiopathic and the degenerative Chondromalacia Patelllae. The idiopathic Chondromalacia Patelllae, or simply put CMP, affects mainly adults and females, that's the younger adults and the females. But the degenerative type of this condition affects many older people who then have reached an early stage where they have lesser supply of needed nutrients to be able to keep this structure called the articular cartilage in its normal function. So degenerative means destruction of the cartilage. So we'll talk about some of the differential diagnosis to this condition, that is other condition that could look like this condition. The first one is called patellar subluxation, osteoarthritis, rheumatoid arthritis, anterior knee pain, patellofemoral pain syndromes. These are some of the conditions that could look like this condition called the Chondromalacia Patelllae. Some pictures will be shown to you very soon. and let's keep us fingers crossed. So some of the symptoms we talked about: signs initially, that is seeing tenderness and moving the knee by the medical practitioner. So some of the symptoms, that is what the patient presents to the hospital. So when the patient comes, what the patient will say that maybe I feel pain in my knee. The pain is aching. Like under my the bone in front of my knee. I feel pain under it. The small bone in front of my knee, I feel pain under it. So then this could push us into that direction of this condition called Chondromalacia patellae. But then the other symptom that the patient will present, the patient will complain of, he feels like I'm swelling or some instability. That is when the patient walks, it doesn't feel stable when walking. And also we could have also crepitus. That is, you could hear noise in the knee, So in fact, when you are squatting up and down, you're doing exercises at home, when you're squatting up and down, you're hearing this noise, up and down. For example, enjoy that noise, but then it's a very, very bad sign of knee problem in the near future. Tomorrow next, or the next month. So don't be so happy enjoying the sound when you're squatting up and down, especially when they are carrying out exercises on the television. If you hear this noise, you shouldn't be encouraged to continue the exercise. You should stop and then seek medical attention so that we can prevent further deterioration of your knee. Okay, so aside these symptoms, let's look at some of the diagnostic procedures. That is machine that we can see through to be able to diagnose this condition called Chondromalacia patellae. So first of all, we could have an MRI. This is a very, very important machine. It could see very detailed structure. It's called the magnetic resonance imaging. You could see detailed structure of this condition, and then we can appreciate this. Okay, so MRI is very effective, and then it's actually not invasive like X-ray that you have so many radiations, but then it gives you a very good presentation of this condition. Okay, and it's very specific. Yes, it's very specific, and then it's very sensitive. Secondly, we could have X-rays, we could have ultrasound, we have so many other tests that we could do to be able to see and then diagnose this condition as such. So then we move on to outcome measures. So what are outcome measures as physiotherapists to be able to diagnose this condition? So when we come to a clinical setting, we could use outcome measures such as anterior knee pain scale. So your daily routine, when you come for therapy once, twice, thrice, we could observe the changes and then see whether it's getting better or it's getting worse. Then we can modify the treatment as such. We have other outcome measures such as the visual analog scale. So this helps us to see the pain level. So when you come for treatment once, and the next time we could assess whether you're doing better or you're doing worse. And then also we could have the 5 Coos scale. This could also see and measure your level of activity during therapy and after therapy. Then we move on to the very important part of this topic called examination. It's a very important topic because this helps us to diagnose this condition very, very effectively and as such treat them. Okay, so when we through examination, we go through 4 very important procedures. The first is called the observation. As physiotherapists, is a very important practical thing that we do. That's observation. We are supposed to be very observant because the least change we could do better or could aggravate the patient's condition. So we could see a normal joint space, but then we could have slight effusion, that is swelling in the knee. When we observe, just by looking at it, we can see as physiotherapists. Okay, and also from observation, you go to mobility. So as we said, we as physiotherapists are very important in assessing. So through mobility, when the patient lies down, we bend the knee forward and see if most of the times the knee pushes backwards to touch the thigh or near to the thigh, the back of the thigh, very easily without pain. But constantly doing it, the patient or the person complains of pain that is consistent. Also, we also talk about feeling after observation and mobility, that's moving the knee. Also, the person complains of pain in the knee and feeling of the noise, that is the sound, that is called in scientific term crepitus in the knee. Also, then the final one is the X-ray. So we are very, very critical and very, very decisive about using of the X-ray, because we can't see through the knee as best as possible. So the X-ray helps us confirm this condition to be X-ray, to be Chondromalacia patellae. So the very four important things as physiotherapists we look for when we are diagnosing this condition as Chondromalacia patellae is: 1, we look for observation, mobility, that is movement of the knee. The third is how the person feels, and then through an X-ray. So some of the tests that as physiotherapists we do to be able to diagnose this condition is: 1, we have Clark sign test, patellar grind test, compression test, extension resistance test, critical test. So these are, if I'm supposed to talk about them, we'll go through the night and then we will not finish. But then one important test, that's the last one, the critical test, comes in 5 different forms. So the patient sits in a high chair, and then the legs hangs down. The patient raises the leg up to 30 degrees, 60 degrees, 90 degrees, 120 degrees. But in between the movement at 30 degrees, the person waits for 10 seconds, and then continues the same 10 seconds to 60 degrees, to 90 degrees, to 120 degrees. When the patient complains of pain during the activity, the patient lies down, and then we try to mobilize the knee joints. When the pain goes down with activity, it indicates also that the patient could have Chondromalacia patellae. But then the X-ray is a very, very good confirmation of this condition. So aside all these things, the symptoms, the signs, the presentation, the condition, which people are affected, and how we are able to see this condition. How do you treat this condition, one may ask? We have 3 main ways of treating the condition. We have through non-surgical and then surgical means. The 2 main ways. The surgical means could be through chondrectomy. We could have or shaving. Chondrectomy or shaving. We could have drilling method. These are all surgical means. I'm prelude to be able to describe these conditions or these procedures, but then we'll leave it to the surgeons to talk about it maybe some time to come. Chondrectomy or shaving, we could have drilling method, we could have a full patellectomy, that is remove of the patella completely. We could have other treatments such as also replacement of the damaged cartilage. So the cartilage under the patella that causes the distraction, that is causes the pain in the knee, we could remove them through surgical means and put an artificial one made of polyethylene cap prosthesis. But then the symptoms could present again after some period of time, because we have other cartilage at the knee too, and this could also worsen the condition. So surgical means are very, very critical, and they are the last option when all things seem impossible. We could have other surgical means, including the autologous chondrocyte transplantation under the knee. So we have a particular part of the knee of the leg called the tibial periosteum or the tibial plateau. These could have various surgical procedures to be able to restore the joint integrity and then reduce the pain, thereby increasing function in the knee. So it's very important that also we address the movement deficits in this condition, that is biomedical or biomechanical aspects. It's very important. That is, when the person is moving, what are the effects of this condition? It could hinder movement. The person could walk in a gait we call antalgic gait, that is painful gait. The person cannot put the leg on the ground as effectively as possible. Also, we could have tightening of the structure called the medial capsule. We would have so many presentations of this condition. We could have a shifting of the knee to one side, that is compensating, and then we could also have excessive pain underneath the patellar bone. So aside the surgical means, what are also the alternative, which is considered first before the surgical means? The non-surgical means are the conservative means or the therapeutic means. That is when we see a physiotherapist. One and very foremost thing is education. So every therapist is supposed to educate you about this condition, as we are doing now, and then after that we go through the therapy. So after educating you and then informing you about the condition, then move into exercises. Before the exercise, if the pain is spotted early, probably within the first 3 weeks, we go through ice therapy. That is, you put ice around the knee joint, you put ice block around the knee joint. So in case you hurt yourself where the wound is not exposed and you feel the pain in your knee or any part of the joint, it's very good that you use ice. But if you could see blood coming out from the particular part of the body, don't use ice because it's not good. If it's a swelling in at your head region, you can use ice, and then your knee region too, you can use ice. Then after the ice, we have other therapeutic measures. We have uses of TENS, that is transcutaneous electrical nerve stimulation, to relieve the pain. After that, we go through those exercises, stepwise exercise, that's progressive exercises. We have exercises such as isometric exercises. We have hamstring exercises. That's when you sit down, you straighten your leg up and then bend your foot forward, and this helps to stretch the muscles at the back of your knee. And these are very, very important exercises. We also have patellar taping. So we have a device we call the kinesiotape, and this helps us to be able to relieve pain in your knee. So it's a tape that we put it around the knee region to relieve pain and also relieve swelling. Aside taping, we also have NSAIDs, that is non-steroidal anti-inflammatory drugs. This helps to reduce swelling, but we are not mostly encouraged to take in these drugs since this could also have side effects. We could also have exercises such as hip strengthening exercises, because the hip is also a point before the knee where we need to keep it strong to avoid undue pressure in the knee or on the knee. We also have hip abductor strengthening, that is the side of the hip. There are muscles that are very important that need to be strengthened to be able to reduce pressure in the knee. Aside that, also we have patellar realignment, yes, and so these help us to be able to keep the knee in this normal position. Aside that, also we could have foam roller. So the foam roller is a device where we could roll it around the knee, and this helps us to relieve pain and improve the strength of the knee. Okay, so we've talked about so many things. I'm sure we've learned a lot. The treatments, the signs, the tests, who are affected most. So today we talked about the condition called Chondromalacia patellae. Chondromalacia patellae. I'm very glad that we've learned a lot. So let's look at some pictures of this condition, and then we can be able to appreciate this condition. I'm very honored that we are very, very listening to this condition. Okay, so this is the patellar brace. So this is very important structure that helps to minimize the pain in the knee. So this structure or this device is very important because this condition is very, very impactful. In fact, it could worsen. Yes, it could worsen if we don't protect the structure in the knee. This device is called the knee brace or the patellar knee support, and this prevents the bone from shifting from one side to the other. So this is a surgical means. So we could have a procedure we called arthroscopy. So this helps also to remove any likely swelling or degeneration in the knee. So this is also another knee brace called the patellar knee brace. We could see some pictures. So this is the patella. You could see the degeneration. So this is I'm sure we can see it visibly. Let's take a close look at it. So this is the patella. So it's not so clear, but I'm sure we can see this is a patella, and underneath is the articular cartilage, and this is worn out, and this could cause the chondromalacia patellae. Okay, so this is an MRI showing the knee joint, and then you can see here, those who have the scientific eyes, I'm sure you can most of us might not understand, but yes. So this is the um, knee, this is the patella, and then this is the articular cartilage. There are some, you can see it wearing away. I'm sure most of us can't see it, but it's a medical explanation. So this is the stages of the wearing away of the cartilage that we're talking about. You can see the first one is the initial stage, where we have quite good wearing away, and then the second one is the worsening stage. So when the cartilage is worn away, it will have impact on this structure here. So you can see this one is wearing away a little, but that's the third one, is much serious compared to this two. It's wearing away. Okay, so this are a physiotherapist assessing the patient with knee pain. Okay, so this is also a Chondromalacia patellae. We could have this pain in the knee. Okay, so this is another one. You can see it very visibly here. We can see the degeneration here. Okay, so this is an MRI also showing us the composition of the knee, and I'm sure that yes, we are very well understanding this condition. Another one too is here, where we have the degeneration of this patella. We can see it here. Yes, that's the articular cartilage. Yes, I'm sure we can see it very visibly. And this is an X-ray of this condition. It's not so understanding, but I'm sure you can see the cartilage here. Yes, it's not really visible here. So this is the patella here, the bone that we're talking about here, underneath the articular cartilage. Okay, another one here. Yeah. I'm sure we are now conversant with this condition. That is the Chondromalacia patellae. That is the condition. Okay. So great. Yeah, I'm sure we've learned a lot. Yeah, we've learned a lot. It's been a wonderful night. It's been the grace of God, and by God's grace, we've had a wonderful time. If you have any question, we can put our questions online, and then we can give you an answer. Thank you very much for your time. And one comment I learned and I appreciated a lot was the topic, that is the fact that they are really scientific terms, and we want very common names that we can appreciate and then be interested in listening to, and it's very well taken into consideration. Yes, so the common name, the knee pain. So the next topic, I'm sure we'll have a common name for us to have a very good interest in this presentation. Yes, I'm very glad for your time. So if you have any question, you can see Gerald, Philip, yeah, so many, David, yeah, and so many others online. Yes, it's a Sunday, the 10th of January 2021. Yes, God has been faithful to us and He has given us a day. We are entering into another week. We are trusting God for a wonderful week, that the Lord God will take us through the week, and He will preserve us, and the Lord will preserve us. Okay, so without much we do, thank you very much for your time. And the next topic for our presentation next week is also a very interesting topic. It's quite simple, unlike today. In fact, we had a very unusually tough time preparing for this presentation. In fact, if I tell you that I had an easy time, I'm lying. But by the grace of God, yes, it's just the grace of God, nothing else. And then He has been faithful unto us, and then He has given us a wonderful day. Okay, so next week we'll be talking about a very interesting topic. Okay, what's the topic now? The topic is Dupuytren's contracture. I know this is a big word, but the simple word is finger stiffness. So we have a stiffness in the finger that causes the finger to shorten. So some people could have this condition, but they don't know about it. They think it's maybe an accident or something that will go in a short period of time. But then it can be treated and it can be managed to the best of our ability. So let's tune in next week and let's keep on the discussion. Let's share the page, let's share the flyers, and then let's keep supporting this good work. May the good Lord be with us all. May the good Lord preserve us. May the good Lord take us through this week, preserve us every single day, and keep us safe till the next week. God bless you all. Have a blessed evening. Have a great night. Take care. Bye.